Hey, just gonna take a minute to answer this. I'm probably gonna get a lot of feedback on my opinion of this, but I think that it is really important. So this patient is asking, I have 5 grams of semaglutide and 5 milliliters of bacteriostatic water. I was told to mix the full amount with bacteriostatic water with the semaglutide. Is that correct? So first things first, I think that you have 5 milligrams of semaglutide and you're supposed to mix it with 5 milliliters of water, which would give you a 1-to-1 ratio. And I could do the math and break down the units for you for that, but I think that you probably got research peptides, and because I've never seen any compound pharmacy that will have you reconstitute the medication. And I understand why people get research peptides, because this is a pretty expensive medication. We do try to keep the most affordable prices, but I still know that even our prices are not affordable for some patients. So I definitely understand why patients are buying research peptides, but it's just really scary. I started to look at some of these companies. I've seen them before, but I started to look at some of them. They are hiding their domain, who owns their domain. They've only been open, or the website's been open since the beginning of May. Specifically, I'll talk about the Triggered brand. Yes, so their website's only been open since the beginning of May. Their lab, I found out, was located in China, but that's not because I got a hold of anybody. It's just I did some digging with the emails and number that are listed on their website, which have tons of puppet, are also linked to other websites too. So as far as being legitimate, I would be just very careful of the research peptides. I do know a nurse that used to take care of patients who had Guillain-Barré from heavy metal poisoning, from getting meds from China. I do know that we get a lot of meds from China, but those are at least regulated. So I would just be very careful. And if you don't like what I have to say, then just don't comment. But this is my PSA.